If you have restless leg syndrome and require an iron infusion, what formulations of iron should you get? I'm Dr. Andy Burkowski of ReLACS Health, and today I'm going to talk about the types of iron infusion that are available. Well, there are generally two formulations of iron, which is I would not recommend, and four that I would recommend. This is pretty much consensus among restless leg specialists. Iron infusion is generally considered now a first line treatment for restless leg syndrome and very important for many people to obtain these. The two formulations not recommended are iron sucrose and ferric gluconate. These are older and cheaper formulations of iron, but they're much less effective and they have poor iron binding. So the iron, when you get an infusion of these, a lot of the iron is released into the bloodstream, so that limits how much you can get. So to get the magic number of 1,000 often requires 5 or 6 infusions. These formulations also have poor H-ferritin binding, and H-ferritin is a protein or a molecule that carries iron into the brain. And the idea of increasing iron levels in the brain is the underlying reason IV iron infusion works for restless leg syndrome. So you want more of that iron into the brain. And the clinical trials have shown that these formulations are just less effective than the others. So which four would I recommend? Well, number one would be low molecular weight iron dextran, or INFED in the US. This is these four is the older formulation, but tends to be the most cost effective because it's less, the drug cost is less expensive, and it can be given over 1 hour at 1,000 milligrams. It has very few side effects, minor side effects, maybe 2 to 5% of the time at the most, and no serious risk of side effects. Unfortunately, this drug has a bit of a stigma that is unwarranted, as one of its other drugs, like a cousin called high molecular weight iron dextran, was associated with infusion reactions very rarely many years ago. And this drug has since been taken off the market a long time ago. But for whatever reason, the medical field still is afraid of infusion reactions when it comes to iron. And there's no evidence that low molecular weight iron dextran causes infusion reactions. So some of the infusion centers still infuse over a 4 hour period of time when it can be safely given in less than an hour. And in the US, at least, they still do a test dose where you get 25 milligrams and have to wait 15 minutes or so before you get the rest of the iron, which Europe has mostly done away with. The second formulation of iron is ferromoxetol, or the brand name Ferraheme. This comes in 510 milligrams. It's a little more expensive, but it can be given at 1,020 milligrams in just 20 to 30 minutes with very few side effects. And though not quite as cost effective out of pocket as INFED, this is a excellent alternative, particularly if this formulation has insurance coverage for it. A third formulation is ferric isomaltazide, or monoferric. Monoferric has been formulated to be given 1,000 milligrams in a short period of time. It also has very few side effects. Unfortunately, as the newest kid on the block, this tends to be the most expensive formulation of iron. The fourth of the strongest formulations of iron is ferric carboxymaltose, or Injectafer. This has actually been the most well studied in restless leg syndrome, so it clearly is highly effective. But there are two major downsides to Injectafer, so I would rate this the fourth of these four in order of preference. The first downside is it comes in 750 milligram vials. So to get to that magic number of 1,000, you have to get two 750 milligram injections 1 week apart. So it's a little more expensive and more of a hassle. The second issue is a situation called hypophosphatemia, or low phosphorus levels. And this can happen shortly after the infusion or for several months thereafter. And it's a little bit of a concern long term for people who are predisposed to low phosphorus levels. So the phosphorus levels may need to be monitored, and repeated infusions once or twice a year with this is probably not recommended in those individuals. Otherwise, these four formulations are the ones to choose for the best effect and least downside for restless leg syndrome. As always, this video is for general information purposes only. It does not constitute the practice of medicine, and all decisions regarding iron infusion, restless legs, or any other health condition should be made under the medical supervision of a licensed medical professional.